Hello, I'm Dr. Babak Larian from Center for Advanced Parathyroid Surgery. Today we're going to do a case study on a patient who ended up having parathyroid hyperplasia. And fortunately, I have quality of life surveys for this person from before surgery and for 4 years after surgery. So we can see the progression of her recovery from this awful illness. So let's go ahead and start. This is a 55-year-old woman who complains of fatigue, memory loss, poor sleep, irritability, depression, some bone pain, nighttime urination, palpitations, and hair loss. Very non-specific symptoms. So she was doing routine laboratory studies, and finally they were able to find that her calcium was elevated, which led to them working that up and doing a bone density study, a DEXA scan, which showed she has osteoporosis. So further blood tests were done, which showed her calcium was 11.2 and PTH was 81, with a normal vitamin D in the 30s. This led to her having scans to localize which gland is abnormal. So she had an ultrasound which showed a right lower parathyroid that was enlarged. I did an ultrasound in my office as well, and I saw that right lower gland, but I still had a little bit of suspicion that there was more to the story. So I ordered a 4D parathyroid CT scan. And the 4D CT scan showed not only the right inferior parathyroid to be enlarged, and potentially the left inferior parathyroid to be enlarged as well. Proceeded to take her to the operating room. She underwent a parathyroidectomy, minimally invasive parathyroidectomy, under general anesthesia with a breathing tube that monitored the vocal cord nerves, right? Just to increase the safety to the vocal cord nerves as I was looking at both sides. So during the surgery, I went to that right inferior parathyroid that was very much enlarged, and I got a PTH level before removing it, which was 73. And after I removed that enlarged parathyroid, the PTH came down only to 63. It wasn't more than 50% reduction, which tells me that there are other parathyroids that are overworking. The parathyroid was sent to the pathologist while we were in the surgery, and they saw that it was both parathyroid tissue, but the majority of the specimen was actually lymphoid tissue, which is why there was some question about what the ultrasound had found. And as you can see, this is the specimen, the whole specimen, and the circle here is around the parathyroid at the edge of it. The remainder of it was lymphoid tissue. I went on to find the left inferior parathyroid, the left superior, and then these two were very similar in size, right? And so I came back and found the right superior parathyroid. I biopsied all three of them to confirm that they're parathyroid tissue. As you can see, I put a little titanium clip on the area away from the blood vessels coming in, got a little small specimen sent to the pathologist for all three. Once confirmed by the pathologist that this is parathyroid tissue, I removed the two largest, which were these two, right? These were the two largest, and the right superior was the smallest of the three remaining glands, right? Or of all four. So again, the PTH before removing anything was 73. At 5, 10, and 15 minutes after I removed these two and had biopsied this one, the PTH level came down to 19, 17.8, and 16. So it came down and plateaued to a lower number. And this gave me two bits of very important information that someone needs to know, your surgeon needs to know, and you need to know during an operation. First, that the operation is successful. I was able to bring the PTH level down by more than 50% and keep it down at that level, right? So I was able to remove an appropriate amount of parathyroid tissue to resolve the hyperparathyroid problem. Also, because the PTH came down and plateaued at a lower number, that tells me that the last parathyroid that I left behind, the right upper, was functioning adequately to make enough PTH for the person to have a normal functioning calcium parathyroid system, which is really important because you want to make sure you don't replace this person's hyperparathyroidism with hypoparathyroidism, an equally problematic disease, right? And I had confirmation during surgery that that was not the case, that we had a successful surgery and she had a good functioning parathyroid left behind. The PTH level and calcium level at 1 month after surgery came down, calcium from 11.2 to 9.4, PTH from 81 to 28, vitamin D was 36. So at 1 month, it was clearly indicating that the surgery had been successful and she was doing well. At 12 months, the calcium was at 9.2, PTH 32, vitamin Ds were a little low, so we gave her supplements. And that's not unusual because during the post-operative period, the osteoporotic bone is going to try to take that calcium credit back and is going to try to bring the calcium down and deplete you. And so if you replenish the vitamin D more, you absorb more of the calcium, because without vitamin D, you only absorb 20% of the calcium. With vitamin D, you go up to 80%. So that's really important. Now, let's look at the quality of life surveys that we did before surgery and for the 4 years following the surgery. These surveys are interesting. They have all the symptoms that are frequently present in the patients that affect their quality of life. And a high number of 4 means they never have the symptom. A 0 means they always have the symptoms. So for her, fatigue, sleep issues, and nighttime urination is something that she always has, and lots of problems: incontinence, kidney stones, poor appetite, anorexia, nausea, upset stomach is issues that she did not have, right? So her score is 50. The higher the score on this survey, the less symptoms she has, the better she's doing. So she starts at a 50 before surgery. At 6 months after surgery, she goes up to 58. So all the 0 symptoms got better, right? All the things that she was always experiencing were better, even the sleep problems and nighttime urination, okay? At 1 year, she went up to 62. So not a dramatic change. And the worst number she had a 1 at nighttime urination, but she wrote a note that I drink a lot of water. So that's why she was explaining why she has a lot of nighttime urination and a happy face. So at 2 years, her score went up to 65. She didn't have any 0s or 1s, right? So a lot of the symptoms had gotten better. So at 2 years, she was better than 1 year, right? Now let's look at 4 years. At 4 years, her score jumped to 78, right? And that's quite a leap. And you can see that all her symptoms are in the 4-3 range, which means never or hardly ever she has these symptoms, right? So the moral of the story is that hyperplasia in the hands of someone who has expertise can be treated really well, right? And because when someone has hyperplasia, it means that they've had this illness for years and years and years before they discovered it, right? The recovery will continue to show improvement even 4 years after surgery. So being patient with yourself, with your body, being active, physically active, doing different types of activity to force the rebalancing, doing different kinds of mental exercises to force rebalancing, all of that is really helpful in helping you recover. And remember, your recovery can continue to show improvement for years and years and years and years. If you're interested in clear parathyroid information and need help with what to do next, follow us, visit us at parathyroid.net, and subscribe to our channel. Be well.